We are doing a huge piece of work around how to make nursing midwifery more climate smart. And I'm going to go back and I'm going to start putting in the bonus that involvement of carers around self-care will have in that work. And I'll discuss it with the network lead. There's a network of senior nurses across Wales who are leading on work around low carbon alternatives, and I'll raise it with them as well.
Strategic plan for the next 3 years is called a national conversation, and that's what we'll do. We want to hear from everybody. We want to speak to as many people as possible, unpaid carers, citizens, professionals, third sector. What are your experiences? What do you think could be better, or what's not working well?
To be listened to and people discover as an unpaid carer what I'm willing and able to provide. Although it's very important to find out what assessed needs are of the cared for, I think it's equally as important to find out what the unpaid carer is willing and able to provide. By doing that, yeah, it might cost you a little bit more in the short term, but it means that that relationship could go on for 20 years. If you don't make a proper support plan, 2 years, and then it's going to cost a heap load of money for the next 18 years. So I think it's got to be more important on what the unpaid carer is willing and able to provide.
We know the direction of travel we need to take the social care workforce, including the social work profession, forward to make it sustainable. That's mapped out in our ambition and workforce strategy, and that's agreed with the sector and the people from the public that have contributed to it. So I suppose my job is to maintain that momentum, because that's my lead strategic document that I'm measured against in work. And if we do that, we're going to create capacity and resilience within the workforce, which means they will have more capacity and resilience to work with unpaid carers on a better footing than they currently can.
Well, my strategic plan is started when I was a young girl, really, which is a family promoted strategy, which is look after everybody, be respectful, stand up and be counted as part of your community. And I mean, it's probably not going to be a new thing, but I can promise to continue to speak up for people who are vulnerable, not just unpaid carers, kinship carers, the people that we care for, my colleagues, I can promise to do that.
Within the contracts for pre-registration, we embedded some specifications around attracting applicants or prospective applicants from disadvantaged or underrepresented communities, one of which was the carer community. We collect data on that, so I should be able to tell you how many students have reported that they're carers. I can't tell you what it is, so I need to go and look at that. And then I think what I'll try and do, or will do, is see how we can capture their experiences and their feedback, and see how that can improve the education for pre-registration education professionals. So I think I'm mindful that those individuals will have those lived experiences, and they'll probably be they're the future workforce. So I think there's no better testament if we get those individuals practicing in Wales. So